What is autism? Autism is a complex neurodevelopmental disorder that impacts the areas of communication, socialization, and behavior. Children typically begin to show signs of autism by the time they turn 2. While the overall affected areas are similar, there can be extreme differences in how they manifest in individual children. For this reason, autism is considered a spectrum disorder. Children who receive a medical diagnosis will be diagnosed with autism spectrum disorder. You will often hear professionals say, if you've met one child with autism, you've met one child with autism, to illustrate this concept. Characteristics of autism. Autism characteristics fall under 2 general areas: deficits in the areas of social communication and social interaction, and restricted repetitive patterns of behavior. Let's look more closely at these areas of deficit. Social communication and social interaction deficits are split into 3 main areas: deficits in social emotional reciprocity, deficits in nonverbal communicative behaviors used for social interaction, and deficits in developing, maintaining, and understanding relationships. Deficits in social emotional reciprocity can range from abnormal social approach and a failure of normal back and forth conversation to a reduced sharing of interests, emotions, or affect, and even failure to initiate or respond to social interactions. Deficits in nonverbal communication used for social interaction can range from poorly integrated verbal and nonverbal communication to abnormalities in eye contact and body language, or deficits in understanding and use of gestures, to a total lack of facial expressions and nonverbal communication. Deficits in developing, maintaining, and understanding relationships range from difficulties adjusting behavior to suit various social contexts, to difficulties with sharing and making friends, limited or non-existent imaginative play skills, and even the absence of interest in peers. Restricted repetitive patterns of behavior, interests, or activities fall into one of 4 major categories: repetitive actions, inflexibility across contexts, restricted fixated interests, and sensory differences. Let's cover these in a little bit more detail. Children with autism will often use stereotyped or repetitive motor movement, use of objects, or speech. Some of these might include motor stereotypies, or what we often refer to as self-stimulation or stimming activities, things like hand flapping, flicking the fingers, rocking back and forth. They can also line up toys or objects. They might flip or spin objects instead of playing with them the way that they're designed to be played with. Students might exhibit echolalia, where they repeat the words that you're saying to them, or delayed echolalia, where they're repeating something that they've heard in the past, either from a favorite movie or a cartoon. And they might use idiosyncratic language. For example, a student who wants to go to the movies might say, "I want popcorn." Inflexibility is another behavior pattern that's common with students or children with autism. They may have some inflexible adherence to routines, and when you try to change the routines, they exhibit extreme distress. They may exhibit some ritualized patterns of verbal or nonverbal behavior, have difficulty transitioning between activities, and they may have some rituals related to greetings. Children with autism often have rigid thinking patterns that are very difficult to break, and they may insist on following the same route anytime you go someplace familiar or unfamiliar, and also eating the same foods or the same types of foods day after day. Children with autism have highly restricted, fixated interests that are abnormal in the intensity or focus. They may have a strong attachment to or a preoccupation with unusual objects, and they might perseverate on a specific item or topic. Finally, children with autism may process sensory information differently by having hyper or hyporeactivity to sensory input or unusual interest in sensory aspects of the environment. They may show indifference to pain or temperature. They may have an adverse reaction to specific sounds or textures. They might have excessive smelling or touching of objects. And they might demonstrate visual fascination with lights or the movement of other objects such as fans.